Well, it's a pleasure to step away from the trenches, the bloody trenches of pharma product development for a little bit to be part of this tremendous event. It's a visibly exciting time, exceptional time to be thinking about new entrepreneurial opportunities in digital health. The promise, as so many of you recognize, is finding a way to combine the energy, creativity, and available capital that we see in technology with what I see as the gravitas, the worthiness, and the deep unmet needs in health and wellness. The real difficult challenge, something I think folks in the medical product industry recognize and which many in digital health are slowly discovering, is coming up with something that is truly impactful and which durably makes a difference, solving a real problem in a lasting way, a concept that David Albert of AliveCore describes as turning M-health into M-medicine. Other key opportunities, which I think we're going to get to in digital health, are behavior modification, which represents both a huge need and an enormously difficult problem, care delivery, hopefully involving, as we've been discussing, a greater focus on patients and a greater emphasis on design thinking, and big data, not just what data to collect, but also how to analyze and critically to leverage this information effectively. These are all difficult problems requiring imaginative solutions, which is why I'm especially glad to, reintroduce my two panelists today, Dave McClure and Esther Dyson, early-stage investors known for their originality and passion. Exactly the sort of investors I've described them as VC auteurs that healthcare so urgently needs. Sweet, demure Dave McClure is a graduate of Johns Hopkins and worked in the Valley for a number of years as a programmer, entrepreneur, and marketer at several companies, including PayPal and Mint.com. More recently, he started an investment vehicle, which you've heard about, called 500 Startups, which aims to leverage portfolio theory to invest a relatively small amount of capital in a relatively large number of startups, generally highly focused tech companies. Esther Dyson, the child of two highly accomplished academics, a graduate of Harvard, contributor to Forbes. Right away, I knew there was just so much I liked about this person. After building a newsletter and conference business and selling it to CNET, she distinguished herself as a philanthropist and investor with a particular interest in Space 2.0, including spending 6 months in Russia training as a cosmonaut. I'm not sure how many of us have done that. And in health, especially the role of behavior in staving off illness. She's invested extensively in an interesting range of healthcare startups. So I'm going to join everyone. I thought a good way to start off this discussion was to focus on a topic that I see as common to health and tech, the importance of user engagement as a product feature, especially in the context of behavior change. And I was hoping that Esther could start us off with her thoughts on the unmet market need here, and then Dave could chime in with his thoughts about achieving engagement.
Okay, thanks. Good afternoon. It's kind of obvious, but it's still worth mentioning, as you did, that a lot of these services, the ones that are most exciting to me, really leave most of the work to the user. In other words, what you're trying to do is not even get them to take a pill, but actually have them do something that they don't particularly want to do, or refrain from doing something that they do really want to do, like finishing the brownies they were serving here. Yeah, they were good. So the challenge is how do you actually make that happen? There's a huge need for data, but honestly, there's not a huge need for data showing that exercising regularly is good for you. What we do need is data showing what it is that will motivate people to do that. And I think partly, when I think about this problem in general, it's not a general problem. Different people are motivated by different things. For some people, having their spouse or boyfriend tell them to do something is motivating. For other people, it can actually, especially if you're in a troubled marriage, it can drive you the other way. Some people are shy and don't want to tell their friends. Other people love doing something in public and having other people support them. And in many cases, the users know that themselves. So one trick is simply ask them, have them go through their own profile or almost select for themselves from a list what it is that will motivate them to do what they know they should do. It's all a question, bring back Jane McGonigal. It's a question of designing. The user knows their own tricks. The user knows their own weaknesses. Design something that will let the user help you help them.
Do you think that that winds up selecting for people who are motivated to begin with, whereas the greatest need could be finding people who aren't engaged or who are marginally engaged?
Well, okay, so there's, at the bottom, there are 20%, I don't know the numbers, but they're really in trouble. They're not going to use no stinking app to do nothing. And it's sad, it's a reality. At the very top, there are the quantified selfers and the sports nuts.
Esther Dyson's?
Yeah. I swim every day. But okay, I'll tell you a story. I swim every day. I used to swim for an hour a day. I'm extremely disciplined. I've probably missed one day every 2 or 3 years, except for a whole week while I was in space training. But I could not get
I have that
myself
problem all the time.
I could not get myself to floss. My parents were Europeans, and they sort of thought flossing was an American affectation designed to sell flossing tape. So
I thought that was only true in England.
yeah. Anyway, one evening, an embarrassingly short number of years ago, I thought, gee, if I floss tonight, I will reward myself and take 5 minutes off my swimming time tomorrow. And I have flossed virtually every night since. It's such a cheesy little trick. I'm an observer of this, yet it works. Because I do genuinely want to floss, but I just couldn't figure out what would make me, and it sounds really stupid, but I thought I would mention it because I also think it's enlightening about how people are really weirdly wired.
So on the topic of...
sorry, you were asking about the people in the middle who aren't really motivated. Most people really are, if you get to what counts. For some people, it's, I'd like to live longer. For other people, it's, I'd like to look good next week. Somehow you need to figure out or help them figure out what it is and then leverage it.
So I guess on the topic of maybe weirdly wired,
What do you mean?
Yeah.
Do I resemble that remark?
But no, on the topic of user engagement, which is something that I gather you focus your portfolio companies extensively on and optimizing that a lot. If you could maybe connect the concept of user engagement to some of what the advice that you preach to your...
Well, I mean, I think generally, this was touched on the previous panel, we try and emphasize design and user experience, probably more user experience than design per se, at least visual design, as important for at least consumer internet startups and probably startups that are dealing with small business and others as well. I don't think that's unique to health per se. Yeah, and so I think BJ Fogg has a lot of thoughts on this subject matter also, really trying to design incentive structures that get more regular use. Folks maybe at Zynga, do you guys hear the tinny thing? Is that like happening there? Yeah, okay. Try and adjust a little bit. Is that better? Yeah. Yeah, so folks at Zynga, I'm sure, are probably also quite focused on, what's
Addiction.
the irregular reinforcement schedule? What's the term again? Intermittent reinforcement schedule. Yeah, right. So anyway, basically Skinner, pigeons, et cetera. So I'm not sure that we are doing society at large a favor by getting really good at getting them to be addicted to our apps and services, maybe like healthcare apps. That's something that we should focus on, but probably more likely that the generative and not so useful apps will get better at it faster than the folks in healthcare. So I might be a little cautious about advising what people should do there. I think there's just a ton of different ways that we can bring, sorry, that tinny thing is just like killing me. Am I gonna avoid that or not? Yeah. Yeah. So, I mean, I don't know so much that I'm focused explicitly around use case and frequency of use, although that's always going to be a tactical goal for any entrepreneur and their team. I think probably where I'm most focused is just, can we apply technology in simple ways to solve problems? Because I think we tend to over-engineer and design for very narrow, sort of wacky cases. For a lot of folks in the Valley, we design for sort of geeky use cases that just aren't regular people.
So could you give an example of a use case or an example? So there are a couple of health companies that you've invested in.
Yeah.
Photocracy, right? And then,
sure. So I mean, Photocracy is one that's really just trying to help, provide a regular way for people to do exercise, probably combine that with other people, and a little bit of gamification to help make sure that that's more regular. That's one where I would say it's positively used. The example I was thinking of, this isn't in healthcare per se, but I was doing a little bit of consulting at Mint.com way back in the day, and there's another company called Wasabi that was very focused on user privacy, but required the user to do a whole bunch of things to download and upload their finances. And like conceptually, altruistic, but practically speaking, completely unrealistic in the fact that most people aren't going to upload and download data. And so the thing that Mint.com sort of came up with was using Yodlee on the back end for account aggregation and making that more automatic, right? And so if you thought about ways in healthcare to make data collection more automatic, or the behaviors that we're trying to incentivize more automatic, either through social groups or reward schedules or other things, I think that's where it's useful to try and get positive, regular offline behavior to map into online sort of behavior.
And the idea of being able to have something more automatic. This, I think, relates to the concept you've talked about of social affordance. Is that right?
Well, actually, what I wanted to add was probably the biggest win, if we could figure it out, would be accurate nutritional. The great thing about Fitbit and all those things is they monitor you automatically. I mean, yes, you do need to plug the device in every once in a while.
Like
but
the one you're wearing.
Yeah. Well, no, this is the
Nike
Fuel on my Fitbit's on my underwear. But what's happening right now is people are being asked to record their own calories, which is probably not the most important thing about nutrition anyway.
Way too geeky. And,
number one.
Yeah.
And number two, it's not automatic. Number three, people are really bad at estimating what it is they're eating.
Do you like the approach of the eatery where it takes a picture and you sort of have the community
I still
rated?
think it's probably good for a certain subset of people who are willing to do that. But again, actually, the best thing for eating is probably smaller plates. And
or maybe like, automatic ordering services that are already going to be preparing, more nutritional services.
Yes, but we really should be eating more fresh food that isn't prepared anyway. I mean, it's a big problem, but I'm sure 15 years from now there will be some little device that you just attach to your plate and it can do all that, and that will really, really help people.
I heard that the most useful thing for people for weight control, the single most important intervention, is a food diary. Is that right? In other words, just the physical act of conscious of it. And that's sort of the pivotal step for people, and just being able to do that and then persist on doing it even when you don't want to.
Right. The challenge is, as you said, the people who are willing to do a food diary are a subset of the people who should be faced every day with the reality of what it is they're eating.
So given this perspective, how has it informed some of your investment choices that you've made, some of the companies that you've decided to invest in to pursue these theses?
Well, it's not what you would think. I'll take two. Kias, which is a sponsor here, is very much the join a team, and there's lots of social affordances around that. If you're a member of the team, you can't, your other team members have a right to say, you gotta walk today because you're harming the team, and they have a social right to do that. It's employer funded, that I think deals with a lot of the issues, and of course doesn't reach a lot of other people. Omada, the idea there, I mean, there are many ideas. It's diabetes, pre-diabetes counseling, online plus face-to-face counseling with a group counselor, 10 people per counselor. It says very appropriately, I think there's some stuff you can do online, there's some stuff that's automatic, some stuff requires a person there. We have a huge unemployment in this country. If there are people with the skills to be counselors and those people can help other people be healthy, what a great win. So I look for things that I think kind of swing into natural things that ought to work and frequently use some human intelligence or emotion or participation as well as just technology.
How do you balance then the desire to wanting to do good with the challenge of doing well that a lot of these companies in this space really struggle to find a business model? And even some of the ones that succeed, it's not clear. Like for example, for Keys, they're essentially offered from an HR benefit perspective. So it's sort of like, here, you can do this. They're not guaranteed. They're not getting paid based on delivering particular results. So in other words, whether or not people get fit or not, people are happy to be participating, and that should do good. But whether or not it does good, Keys gets paid.
Yeah.
Right. But that's different than something that would actually deliver a particular benefit. That would be paid based on delivering a guaranteed benefit.
I mean, if Keys isn't effective long term, it's not going to get paid. At the same time, I mean, number one, I wouldn't invest in anything that I didn't think was doing good in some way, and that's why I've stopped investing in video sharing for rich white guys. Yeah, it's just. And so there's not a conflict. There's certainly a dramatic tension. But
you've seen a successful business model, though, for these companies in the space.
Well, I hope I have. I mean, I'm counting on those two as examples. There's also a whole lot of others that are more sort of consumer behavior focused.
Now, Dave, you've invested this year. You're supposedly going to hit actually your 500th, and for those who are wondering, he's going to go beyond 500
next year, probably.
Next year.
Yeah,
does he get an extra 25K?
Yeah, it's a name. It's not a goal. So we're
right. But
we'll
out of
that.
those, a very a small minority are sort of health focused.
We haven't done about 10 right now, depending on whether you consider some family-related stuff and other areas.
Tell us how I mean, maybe just to explain to the audience about what your general investing philosophy is, how you pick your companies,
Sure.
and then the connection between that approach and what you see as the opportunities or lack of opportunities in the digital health space.
So basic short story on 500 is we do a lot of little investments. We expect most of them will fail. We do follow-on checks. The second check probably in about 20 to 30% of our initial investments. We probably do a third check in about half of those. Overall, our expectation is about 5% of portfolio performs at 20x or better. Hopefully 20% of portfolio performs at 5x or better. And if we're right on those two areas, then maybe we make money. Mm-hmm. Not sure whether we beat risk-adjusted returns for more liquid sources of capital, but we try.
And you have more fun.
We certainly have more fun, by far.
And in the criteria, what you look for, and you sort of have these 3 Ds or something?
Well, yeah, the mantra is sort of design, data, distribution, but what I was going to get at is more that we tend to try and de-risk as much as we can on product development, on distribution, on revenue model. So particularly on product, we try and see functional prototype before we invest. Doesn't have to be perfect at all and doesn't have to have traction, but we do want to see that people can build something close to the product. And then we want to see very minimal usage, right? So somebody other than your mom, hopefully using it, ideally that they're paying for it, or at least that the revenue model is not crazy. That typically means transactional commerce, subscription usage models for business or maybe for consumers, and maybe lead gen or affiliate. So we try and de-risk the investments by not saying, okay, we'll figure it out later, which is more the typical VC thesis. And usually we're trying to look at capital efficient businesses that can get rolling in prototype form for $25,000 to $250,000, probably for fuller sort of marketing and growth and operations, maybe between $1 to $5 million. So typically more singles and doubles hitting strategy, not CapEx intensive stuff that does require big VC, although that happens occasionally. Thematically, big customer segments we focus on: consumer commerce, small business productivity tools, and then family and education. And that's where sort of the healthcare stuff starts to come in. So for kids and families, probably EcoMom, which does eco-friendly product recommendations for moms Evo's monitors combine sort of a application focus with a typical remote monitoring service. So cry and sleep data comparison against other kids, so you know whether you're crazy or not. And your first kid, you think you are crazy, and the second kid, you're just tossing him around the room, not worrying about stuff.
Is that your new website, Crazy or Not? Crazy Mom or Crazy Dad or Not?
Well, some of us are crazy. And then we're just starting to look at some elder care stuff. We've done 2 companies, Silver Living, which is basically like Yelp for senior care communities, and another one called Tender Tree that's sort of like a very specific Craigslist marketplace for in-home care providers. So they're mostly all addressing really basic problems that a lot of people would have. You know, it's not really that crazy. It's just applying a little bit of technology to solve a basic problem where we know people will pay. And then most of our risk is around customer acquisition and distribution.
Now, one of the really distinguishing features of your investment is you have a much, just in general, really celebrate diversity and have so much global diversity, so much diversity in sort of every aspect. It's incredible. It's really inspiring. When you think about sort of the health and wellness opportunities, do you sort of see different kinds of opportunities in some of the ex-US?
Yeah, actually, we didn't do this deal, but we were over in India and we saw this guy that was doing. He's trying to figure out how to provide toilets for the bottom of the pyramid, or at least, you know, in India, that's actually, like, I don't know, probably 100 to 200 million people. So there's a lot of people who don't have access to a toilet that's clean or safe.
The Gates Foundation was working on this, aren't they?
Yeah, well, Gates Foundation is financing a lot of different initiatives, but largely, like, there's hundreds of millions of people in India and probably in other countries that don't have access to not just clean, but safe. This is really a shitty thing, but like a lot of women are in danger of rape when they go to the bathroom. So that's like you don't think about that in the U.S., but that's like important. But a lot of people who are very poor probably have 1 to 5 rupees a day. And so subscription use toilets that are geolocated might sound like a crazy thing, but like in a lot of high density, very high poverty countries, that's actually realistic. They might have a cell phone, they might not have a toilet. And so if you can figure out either low-cost usage methods or gamifying advertising or other things to sort of offset that payment structure, you might be able to find a very simple hack that gets people access to toilets.
So now you've just come back from India, as I understand it, right? Have you seen some of these, are there opportunities or you know, chances to do good that you've encountered?
They're huge. Interesting, I didn't actually see a toilet startup, but I did see one that it was an online curriculum for plumbers. And what really, two interesting things about this. One, they're training women to be plumbers, and then they can go work in women's schools or other places where, especially in India, you just don't want men plumbers around. And so the women, I mean, not only do they not have toilets, but when they do have toilets, they break down, there's nobody to fix them. The other thing is, this wasn't going to be a toilet discussion, but the final chapter...
We knew this conversation was going to the shitter one way or another.
The final chapter of this online training was plumbing ethics. And I thought, oh, gee, what is...
Who knew?
So plumbing ethics, it's partly don't leave your tools around and don't leave a mess, but it's also partly the dignity of the plumber, which in India was traditionally, naturally, a low-caste job. And so this is a curriculum to give people not just the ability to learn and earn a living, but a sense of dignity about it. And anyway, India's a great place to learn because there are so many people, they have to be really good at not so much mass producing as in China, but mass customization.
Right. It's also nice because, I mean, this is a strange term, but poverty density, at least in urban India, allows you to go after solving a lot of problems where the economics don't work in other places where there's less poor people.
Like in villages, yeah. So I went to see Jaipur Foot Factory, which is, it's a nonprofit, so I won't talk about it at length here, but you can, they build prosthetic feet and legs, and I was expecting some kind of hospital, but it's more like a machine shop with guys with hammers and welders and torches building these legs and fitting them onto the people. You come in the morning, you leave in the evening with a new leg and a new life.
Wow.
So it's a lot of fun.
Yeah, I mean, the fact of the matter
and
is
there are
that,
huge
like,
opportunities
yeah,
for medicines, again, preventive care.
I mean, toilet business in India is probably a multi-billion-dollar business, possibly tens of billions of dollars.
It is here too, but we don't notice it.
Yeah. I mean, the real challenge is trying to figure out you can like create economic incentives that drive, market solutions to these problems. Because I think, healthcare in this country is just like completely fucked up on the way that we sort of structure it. We should really be paying doctors money to not have to operate on us, right? So everything's incentive-driven symptomatic treatment right now. So healthcare is basically like treatment for, let it get as possibly as
right,
bad
well,
as possible.
And that is finally
activity-based
changing.
versus outcome-based.
Right, so what you should really be doing is paying doctors $2,000 a year to not treat you and have them get an incentive structure on your economic output over your lifetime. So if they maximize their revenue by keeping you alive and productive for as long as possible.
I mean, that's the goal of these accountable care organizations.
Right. Yeah.
So let me ask you about this. So a lot of this discussion has even been around, and much of it, whenever people talk about consumer health, when you talk to Vinod, he talks about, has really been an emphasis on the consumer side, empowering consumers, has really been the idea of almost sort of reclaiming health and medicine from the sort of the medical professionals, or providers, but sort of to take it out of that setting. It's really people talk about patient empowerment and disruption of traditional medicine, power of the people. And so to some degree, it's sort of this deep philosophy of just sort of empowerment, and to some degree, it's just pragmatic because investors don't like dealing with the FDA. I can appreciate the challenges, don't like dealing with the complexities of hospital systems. Is that your sense that a lot of investors in digital health are avoiding dealing with, or focusing on, that they are focusing particularly on consumer opportunities, and B, does it make sense to you that they are, or do you think there are opportunities outside of consumer that, particularly in Silicon Valley, they may be missing?
Well, I think there are both. I mean, there's a huge medical establishment selling into it, helping to make it more efficient. They are now trying to do better aligned incentives. There's now opportunities like Health Loop. Suddenly, if you discharge a heart patient, I think it is, and it comes back within 30 days, you can't, it's now on the organization now has to pay for the guy coming back rather than being able to bill for it all over again. So those things are beginning, and suddenly these institutions are saying, gee, we have to figure out how to foster health rather than just keep performing procedures. That's a huge opportunity, whether it's Health Loop with workflow process or other people dealing with sanitary procedures or just better care. At the same time, I mean, it's just, there's all these different things to do. Consumers, empowered patients, both.
So there's a lot of opportunities. When you look at then investments in digital health, as a recent Rock report showed that there really is the amount's increasing. It's been much better, but the absolute amount is still relatively small. And it looks like many investors are continuing to tread somewhat cautiously. I think tech investors, when you talk to them, many of them are still kind of leery of healthcare. They'll have one or two investments, but they're still really leery, especially everything outside of consumer. And then life science, VCs are struggling to to stay in business. So it's been a real problem. Are you surprised that do you think that their caution that you're seeing is warranted, or are they just sort of being gun shy?
Well, I think if there were 10 times as many investments, you'd probably see 9 times as many failures. I mean, many of these companies will end up combining. Some of them are redundant. They all need to learn to share APIs, work together. So it's partly we need time. We need time to build stuff. We need time to persuade consumers. In the Valley in general, there's a huge shortage of engineers. There's a surplus of CEOs. It's not quite as bad in the health markets, but it's also, it's an issue. So I don't think it's broken. I think it just takes a little time. And so I think Vinod said something wasn't like Twitter or Facebook. Well, no, it's not. It's not just online. You're talking about changing people's behavior offline. You're talking about physical stuff. It's much slower.
I mean, I think the challenges in healthcare historically have been similar in education and a few other sort of enterprise businesses. The sales cycle is typically enterprise, bureaucratic, long. the ability to reach customers and build products is probably CapEx intensive. That's started to change a lot. So I think the exciting things about education and healthcare is you have some of the same benefits in general consumer technology businesses, which is they're becoming a lot cheaper to build, and they're becoming a lot easier to get access to customers. That's not true for everything, but it's certainly true for a lot of stuff. And you're now starting to see mass-produced, physical devices that are lower in cost as well. So you can start doing hardware-software combo items that are not CapEx intensive, and using social platforms and search platforms and mobile platforms get out to a lot of customers. And by going direct to the consumer instead of going through this, sort of Byzantine, very bureaucratic enterprise structure, you can get revenue quickly. So you can't necessarily solve all problems, but the class of problems, which is low CapEx, direct to consumer, become easy to finance as long as you don't fail too frequently.
I think there should be a term, so there's capital intensive, and then there's something like human intensive or inertia intensive, because when you talk about behavior change, there's inertia. And so even the online ones, they may not be CapEx expensive, but they are inertia intensive.
I can get you floss online, doesn't mean you'll use it.
Yeah, exactly.
Yeah.
So
but if I could figure out ways to have your doctor pay for you to floss more regularly,
Yeah,
if you
but then
if you floss 10 times a week, then you get a vacation to Hawaii, right? Like,
Not
you'd probably
enough.
consider doing that.
Yeah.
That's not as crazy as it sounds. There's actually a trade there somewhere.
There is.
There's a trade there somewhere where your regular use of something reduces your life, increases your life expectancy, increases your economic output, and if you trade a piece of your economic output with somebody else who aggregates that behavior, then they can buy the trip to Hawaii for you, right? So just a measure of sort of figuring out that trade and turning it into sort of something that can be an incentive.
I mean, I think it is very challenging to understand. There's all these things we, in general, view as preventive and as being as useful for prevention, but it's hard to understand. It's hard. I think it's hard to quantify exactly what the benefit of various preventive activities are. And one of the things we were talking about, I guess, by email was the concept of, there's a balance between wanting to invest in prevention and then not wanting to over-medicalize and wanting to, and how you view that balance. The idea that, for example, for statins, it's helpful to be, to not have high cholesterol. But on the other hand, if your intrinsic risk is very low, then you, like Eric Topol and others have said, well, geez, maybe you're at more risk by over-medicalizing.
Yeah, I mean, in life in general, you can always find something to regret. Whether it's, I should have taken the statins or I shouldn't have taken the statins, you find out 3 years later that they actually are worse for you than you knew, they had bad side effects. And this is kind of the problem of the 21st century, that we know too much, and therefore we're responsible for acting or not acting. Well, you should have known, and anytime you find out that something is wrong, you want to know why they didn't let you know it 2 years earlier. So to some extent, we need to calm down. To another extent, there's so many things that obviously are good for you, like healthy food, sleeping more.
Yep.
Focusing on behavior change rather than statins, I think, is probably a good idea.
One of the questions I wanted to ask Dave was, so a major critique, which you've discussed, of Silicon Valley has been investing in triviality, where it's a point made by a range of critics, from folks you've known from founders, so Bruce Gibney, who asked, where are the flying cars? To Rupert Murdoch, who tweeted this weekend that on a recent visit to San Francisco, he saw an amazing sense of entrepreneurship, but few new mind-blowing innovations.
I wish I could argue with Vinod if he was still. Is Vinod still here? Is he gone? Yeah. So, so all those arguments are usually put forth by CapEx-intensive investors. So they do have a bias. It sounds very altruistic for them to go after big, meaningful problems, except that what they're really saying is, we want you to go after big, meaningful problems that require a lot of capital, which means you have to come to us to get them funded. And I'm sure some of them have those altruistic motives independent of their investment strategies, but it's curious that many of them align with those. So it's not always the case that big problems require CapEx-intensive strategies. And it's also not the case that solving problems for a small number of people that are meaningful is not meaningful in the aggregate. So like,
I think that's a great point that you've written about a lot. And just
yeah, I mean, solving point solutions for people that generate $10 to $25 million a year in revenue, those aren't going to be public companies. But in the aggregate, small business is probably 80% of global GDP, depending on how you measure it. It's at least 20 to 50% of global GDP. And it's 50% of non-public GDP in this country, right? So like most business is small business. And so solving point solutions, first of all, it's easier. You don't have, if I try and solve problems for all women, that's much harder than solving problems for women between the ages of 25 and 40 with 2 kids in urban areas who speak Spanish, right? That's really specific. I can solve those problems. And so I think, I'm in the business of funding a lot of small businesses. They're still meaningful to those people, like Silver Living, finding a great place for your, elderly family member where they're not going to get treated poorly by people in the last 10, 15 years of their life. Like, that's really important.
I mean, this seems like it should be such a mesh for healthcare. I was talking about it a month or so ago with Dr. Sawyer, where the concept is there are so many different opportunities that we see in health, in medicine, that do seem to be, about the size that you're talking about, that aren't, going to solve every problem for every person.
Certainly the trend in the last 10 years is not that problems have been getting harder and more expensive to solve. They've been getting easier to solve and less expensive. So if anything, the trend over the last 10 years, based on what's happening, is that we should be spending less money solving problems, and we should be able to solve them easier and faster, which should mean, given a finite budget, we should actually go after a lot more problems, not a lot less problems.
Does the point solution approach resonate with you as well? Somewhat.
Big opportunities, big solutions, small opportunities, small solutions still matter to certain people. I want to tell a story that I couldn't get you to ask the question, but the last time I was at a Rock Health thing, and Hallie may remember this, I had just gotten an email from a company that's trying to solve one of the big problems in this business, which is drawing blood. Maybe 5 or 10 years from now, there will be a lot more non-invasive techniques for doing a whole lot of biomarker and chemistry.
And there are some Rock Health companies doing that.
And it's a really, really interesting thing. Meanwhile, though, we still have drawing blood, and there's 2 big companies, Quest and LabCorp, that do it. And then there's lots of little, I'll be very quick. So there's a company that wants to do this as a third-party service. I talked to them about investing. They asked me for $250 to do sort of a free sample, which shocked me. Usually they do that for free, but anyway. Then it took them 6 months to find a phlebotomist in New York that they were willing to send to me. Finally, I get this person, the appointment is made. I write to them and say, by the way, am I supposed to fast the night before? They don't reply. Then finally, the phlebotomist shows up, and she takes the stuff out of her bag, and she says, oh, gee, this looks a little broken, but it really was just broken in my bag. I assure you it's sterile.
It's comforting.
She draws the blood, which I probably shouldn't have let. Anyway, so it's now 4 or 5 days later, and the CEO of the company emails me saying, Esther, there's a certain problem with your blood. I'd like you to call me right away. And I'm at Rock Health. I'm supposed to be talking in half an hour. So I just emailed back, can't you do this by email? What's wrong? And I go and talk to your assembled people. And then I come back out, check my email, and the guy who's the CEO says, it turns out your potassium level is 3 or 4 times normal. And
a couple of bananas in the bag.
So I'm thinking,
oxygenated.
Gee, I should call a doctor I know, but I'm too embarrassed. And then I think of my sister Emily, who's a cardiologist, but I know exactly what she would say. She would say, you see, Esty, I'm right. Consumers like you shouldn't be fooling around with this medical stuff. You need a proper doctor. So I didn't call her. I was too embarrassed. Anyway, I Googled it, and I discovered, as all of the medical people here know, high potassium is a sign of a bad blood draw because you've damaged the blood cells and they've been contaminated, which is fine. But the CEO of a medical company not knowing this was shocking. And the point of this story is a lot of different points. This stuff is tough. This stuff is real. There's a huge opportunity in drawing blood correctly, but there's also a huge danger in people who don't know what they're doing getting into this business.
Wow. Any final comments from you, your sort of grand thoughts?
You know, I'm sure there's big problems to go tackle that are interesting, but I think there's plenty of really small problems that are staring us in the face with immediate benefits to people. So, like, that's the stuff that I feel like is easy to go after. You know, there's things that I care about because I have a 5 and 7-year-old kid. I have family members like approaching 70, 80, 90. So those things are like staring us in the face.
Are there any health companies you've seen that you haven't invested in but said, oh, wow, that's a good idea. I wish I had done that, or I'm psyched these people are working on this?
We haven't announced it yet. We're doing a company out of Canada called Ven.io that's delivering healthy meals. So again, really basic idea, food delivery and food ordering and making so like trying to measure all the stuff you put into your body by taking pictures and like quantifying it, it's a pain in the ass. Right. But if you order a bunch of stuff that you know, kind of the metrics on, then it just becomes much easier to figure out like what's going in the body.
But then you come to a conference and you eat a brownie that's not on the list.
Sure, that's fine. But I'm just saying, like, I don't have to be perfect in understanding that, you know, measuring caloric input exactly and understanding the exact, it's just like mint. Like, I don't have to know every dollar spent to know that I'm having positive impact on something.
Are there any companies that you've seen that, now that you've invested in, Esther, that you thought were super cool and you wish you had, you're like psyched people were working on it, or you wish you had not passed on it, or you had seen it or something?
You know, I don't know about the financials, but I probably should have invested in Fitbit. And I mean, there's a bunch more. There's a lot of them, and you can't do them all, and especially I can't.
I would say that like food tech is an under sort of, it's not food tech, it's just the food industry is this huge, dumb industry that doesn't innovate, that I don't think people understand. There's plenty of opportunities to go after there, and like they're really easy because those businesses are like dinosaurs and they don't move fast, and you can do a lot of innovation really simply in those areas.
You know, there I feel more like what you were feeling about the health industry. That's an industry that does need to be blown up.
Yeah.
Because as long as, no, seriously, as long as they keep potato chips, chocolate bars, school lunches, sugary drinks, yeah, the solution to that is not gourmet meals for a few million people. It's a huge change in social norms.
I agree, but I mean, like, it's just tough because we're evolutionarily designed to be creatures that avoid fast and famine situations, and so we are designed to overeat.
Well, then maybe it's genetic
like,
engineering of us.
No, but that's what I'm saying. I
think
think that's what's probably hard to really do is like, you know, can we design out the fact that we've been built for hundreds of thousands of years in a way that like is fearful of having lack of access to food, and now we just have like shitloads of food,
right?
And it's just like bad engineering or sort of bad environmental design. So it's hard to sort of design out that issue for humans.
Tax it.
Tax it maybe, or incentivize it. I just still think,
I think the time is up.
Yep.
Yeah.
All right, so we'll leave that with the genetically engineering people not to eat. That sounds like a good ambition. I want to thank the panelists for a really interesting conversation.